All right, judgment question strategies. So these are some of the ones where you're thinking, what is the best choice? What is maybe the umbrella answer that encompasses everything? And a couple of these we've kind of hit on. JD, let's go with the first one with you. Which nursing diagnosis is most appropriate for the client who has completed ECT? So what's ECT?
The shock therapy.
Okay, electroconvulsive therapy. So which nursing diagnosis would be most appropriate?
Probably altered thought process because of the confusion afterwards.
Why?
Sometimes. Because that's after the ECT therapy, a lot of times they're confused.
Okay.
At times for a period afterwards.
So why is that a higher priority than knowledge deficit?
It kind of encompasses that with the altered thought process.
Okay. They've completed their ECT therapy, so we assume they already knew what they were going in for, right? So what would be left for them to have a knowledge deficit about? So we might not be too worried about that. Non-adherence related to unpleasant therapies. Again, they've just gone through it, so maybe we're okay there until the next time they need to get therapy. Fear related to failure to understand therapies. Should they understand it by now? Mm-hmm. Yeah. Now that might not keep them from being fearful, but if the whole thing's not right, it can't be right. So altered thought processes is your umbrella there, and it encompasses all of that. Who wants to take the next one, since we've answered it pretty well?
I'll take the next question.
All right. The nurse cares for a client with Alzheimer's disease. What is the priority nursing action?
Use ruminants therapy when interacting with the client. Ensure the client has a clear path and well-lit room. Implement a bladder and bowel training program, or encourage the client to perform self-care. So for priority, I would probably do away with A and D.
Why?
I don't necessarily think that's important, but not priority.
Okay.
It's not going to be the number one thing I do. If I had to choose, I'd probably go with B for safety.
Okay. And why not C? Why not implement a bladder and bowel training program?
Because I feel that safety would, I don't know.
Because of the whole
Yeah, they're false.
Yep. And it's the same process. You're just trying to figure out which thing kind of encompasses all of them. So you're totally right. If you ensure that they have a clear pathway and a well-lit room, then theoretically it might not matter if they have to get up and void 4 times in the middle of the night because they can see where they're going and they shouldn't fall.